want to make sure that I give the best information that I'm able.
Excellent. Thank you so much for that. Yes, I understand that if I'm not incorrect, there's a press conference that the governor is holding at 11. I'm assuming you might have an insight as to what's being said and how that will put in context, add to the context of what the conversation is this morning. I will look to you in case I hadn't planned to introduce anyone other than you, just for time's sake, but if you want to introduce your commissioners as you see them, I'm limited in my screen, as we all are. So we'll apologize in advance for any missteps as we move along here, right? I would like to beg for forgiveness and then, what happened. Well, it's 10 o'clock now. We still have folks coming in. We're about at 47, and like I said, we have a registration of about 109. So we're going to give it just a couple more minutes to make sure we get the majority of folks in the room. I kind of thought this time we would not be talking about being in rooms, but right? That's my plan.
Just, let me know when you want me to start.
Yeah, but just had a few opening remarks from someone to acknowledge and recognize, and yeah, we're going to go ahead and get started. And just some basic kind of rules of the road as we move along here to try to manage a group of this size to the best of our ability. It is 10:02, and we have 70 people in the room, and so I think now is a good time for us to just get started with those opening remarks. And I remind myself now to record our conversation.
Recording in progress.
Yes. Well, good morning, everyone. I'm Deanna, President and CEO of the Washington County Chamber. I want to thank you all for joining us this morning. I know that it was a quick announcement, but really pleased, and thank you all for prioritizing this conversation. As I said, we have over 109 people registered to have this conversation. If you know of others that weren't able to attend, and we're recording that, and we'll make sure that that information is made available to you. I do want to take a moment to thank and recognize the other 8 chambers of commerce that make up the Washington County Chamber of Commerce Partnership. We have Debbie at the President and CEO of the Tiger Chamber, and my co-host this morning, Kevin, President and CEO of the Russellville Chamber, as well as Chair of the Washington County Chamber Partnership. Roy, President and CEO of the Tualatin Chamber. Corey, President and CEO of the Sherwood Chamber. Juanita, Executive Director of the Forest Grove Cornelius Chamber. The Banks Chamber and the North Plains Chambers are also part of the partnership. Not sure whether they have representatives with us here this morning, but wanted to make sure to recognize them as well. I want to thank Washington County Chair Catherine Harrington for joining us this morning. I'm sure many of you are aware that there was a conversation that took place on Tuesday during a county commission work session with mayors from around the county, and the discussion was regarding the impact the Delta variant has had on our county-wide healthcare system. Chair Harrington agreed to convene with us today to provide additional context to that conversation, as well as to provide an opportunity for our restaurant industry to provide to comment or provide feedback, please use the chat feature. Chair Harrington is going to begin our program this morning by providing a backdrop to the discussion that occurred on Tuesday, and any other information that has transpired since then, which is amazing. It's something incredible, and it seems like there's as they know, they mute her comments for the night. We'll open it up to questions and comments. Any questions before we get started? Just raise your hand, use the raise hand feature. I am not seeing any raised hands. Debbie, do you see anybody? All right, let's get started. Chair Harrington, you have the floor.
Thank you, Diana. Please only give me 5 minutes. Thank you, everyone, for being here. And I don't use that phrase often enough, so thank you. Please know that. I want to recognize that there are additional elected officials in today's meeting. My colleague, Commissioner Jerry Mullen, Hillsboro Mayor Steve Cowboy, Hillsboro City Councilor Rick Van Becken, and at least Tigard City Councilor John Goodhouse. There may be others, but those are the last time I looked at the participant list a few minutes ago. I appreciate the willingness and responsiveness of this chamber for meeting with India as places that are this is not the August, the month of August that I wish we had. A lot of people are getting sick, and that includes children. We, in essence, are dealing with a humanitarian crisis. Though I haven't looked that up in the dictionary to make sure I'm not overstating the case. On August 6th, the governor convened all the county chairs and judges across the 36 counties to lay out that the Delta variant was here in Oregon, the numbers were escalating rapidly, and reminded us that we now, the counties, have full public health control. After that, I moved forward and asked my colleagues to consider enforcing the mask requirement. That was on a Tuesday after the day. The following day, the governor announced a statewide mask requirement. On Monday, the 16th, the governor reconvened the county chairs and judges and brought in additional health experts. I understood from the August 6th meeting via a question that I asked that Director Allen answered that our regional hospitals in the Portland metropolitan area are the backup to all the other hospitals in the state. The data point was the number of people going to hospitals in Jackson and Josephine County, 20% of those patients were being transferred to our hospitals. So what the authority to put in place, but to examine what the impacts are. And I have tremendous respect for not only my colleagues on the Board of Commissioners, but also in other elected officials to be examining those forces. So let me be clear. We do have a humanitarian crisis, but we want to ensure we're doing our best to protect lives, especially for kids who are just about to start the school year, but also to preserve our economic recovery. None of us wants to impact your ability to run your businesses. None of us do. So, what I'm about to say is new information. You can and should, well, go ahead and watch the governor's press conference at 11. She'll tell you more. The one thing that I will say is she's not going to put in place a shutdown. Our public health, our regional public health team would like to see a state shutdown in order to help the hospitals. That is not going to happen for a lot of really good reasons. But could we put in place restrictions on businesses? Yes. Could we do variations on the theme? Yes. But guess what? All these different options have impact to you and your businesses and to those of us who have gotten vaccinated and follow the rules. So I sit here today, back to the point that I was at 2 weeks ago. Next Tuesday, I've asked my staff to put forward information before our board to enforce the mask requirement. That will protect all our workers and allow your businesses to continue to operate just fine. So that's brand new information. I won't pre-announce all the other things that the governor will be announcing at her press conference at 11. And I'm sorry, Commissioner Willie, if I'm surprising you with any information. If cities want to do more, they possibly could. But I sit here today, I'm no longer advancing the ask to restrict dining in any way because this surge, this humanitarian crisis is underway, and I don't believe that the problem is a state level problem, and doing something just in Washington County is not going to be enough to change the situation for regional hospitals. So I accept that there are limits to what we as elected officials in Washington County do. It's a horrible choice to be in. So I've exceeded my 5 minutes. Thank you, Deanna, for giving me this time. There is copious amounts of information available on the website, coronavirus.org.gov. I apologize for not having the energy of these last 4 hours to be able to write down wherever we are with vaccination rates for all the different demographics. It's all low. I believe we're here this is not a capacity limit. No, this is not a capacity limit. Instead, we already have a state requirement that everyone be masked when they're outside their home, whether you're indoors or outdoors. What I'm concerned about is making sure that our workers are protected. So how does it affect you? I want you to ensure that your employees know they need to wear a mask. Just like at restaurant workers, they have to wash their hands at least 12 times in the bathroom. Just like people have to be over the age of 21 to get an alcoholic drink. Please let your employees wear a mask. They have the opportunity to complain. We will have the same level of opportunity for them to complain. And then just like our staff did in 2022, this proposal is that on a complaint basis, our staff will follow up, ensure to make sure that businesses have education and where they need to do this. And then with the second complaint, follow up with the businesses again. And with the third complaint, that's where a civil fine would come in.
Thank you for that. So what I'd like to do is first ask any of my other chamber colleagues if they have any questions that they would, or comments that they would like to make before we turn it out over to our participants. And just use the raised hand feature if you could, please, just because I don't oftentimes see Dick's going to help us.
So I understand that on the employer side, not enforcing mask requirements for employees is this complaint written system. Does that also apply to customers coming in and refusing to wear a mask? Is that also part of the complaint process?
Well, patrons can complain to us if they see other patrons not wearing a mask. But I think staff just wants to make sure that we have, like people before, signage that says, please wear a mask. And that's the best you can do.
And there
We're
has
not the police. We don't want you to do that. You feel like you have to. Sorry.
just for everyone's knowledge, I think OSHA and OHA just released like a couple days ago where there is a new 8x11 mask sign that you can print off and post it on your entrances to help with that.
Thank you for sharing that, but really all we're going to be doing is enforcing the state requirements. All you can do is do the reasonable thing of making sure people know that they should wear a mask. But you can't make them put a mask on their face.
All right. Other questions from my chamber colleagues before we go to our participants at large? All right. So again, please use the raised hand feature so that Debbie and I can scan and see. We also do have questions that are coming into the chat
reasonable people should be reasonable players. Is that clear? Does that answer these questions?
Did you have a question? Did you just introduce yourself prior to asking the question?
Yeah, I was just trying to know. Just put like OCHA website with a sign about that. Make sure that they
That was Debbie from the Tiger Chamber, and she's on it.
maybe giving.
Any other questions in the chat that are related to something different question, then we'll share the topic address.
Yeah, there is a clarification. What the governor announced on Wednesday the 11th, that was effective Friday the 13th, was that masks are required for indoors. We're 100% correct in understanding that. Our public health team is now recommending that we all wear masks indoors and outdoors. Okay? What I will be taking forward to my colleagues to consider approving is enforcement for that indoors aspect. We don't have the capacity to enforce everywhere. We don't have the capacity to enforce everywhere the indoors exists. What we're trying to do is protect our most vulnerable people, the people who don't have these necessary choices. So it's just about protecting you as business owners and your workers. Just like for our own employees. The best you can do is have a sign at your door that says everyone's required to wear a mask, and of course there's the exception for when you're eating and drinking, right? That's in those rules. And to make sure your employees are appropriately masked as well.
There is a question regarding vaccination. I won't read the entire question, but just where, in terms of going back to increasing, the focus on getting people vaccinated, where's the county on that?
So we have not let up on the messaging about getting people vaccinated, and we continue to be very focused to increase vaccination rates for those sectors that have our lowest vaccination rates. We're all leaning into having the FDA approval, general approval for vaccinations. We are moving forward, as the board is aware, in requiring employees be vaccinated. The governor has already announced that healthcare workers are required to be vaccinated. Our lawyers are diving into that rule to see who that applies to. It's complex, unfortunately. I just learned this morning that for that healthcare requirement, the date is October 1st. And if they haven't been vaccinated, if they go with Moderna, today's the deadline for them to get vaccinated in order to be fully vaccinated by that October 1st deadline. It's complicated. God, I'm so sick of that word. So I'm not going to pre-announce what the governor's going to announce, but she's already asked employers to please require vaccination of employees. And that's happening in many places. So
excellent. Thank you for that. We have a question from Erica. Erica, would you like to unmute?
Sure. Erica Palmer, representing the Independent Restaurant Alliance of Oregon today. I have two questions. One is shutting down restaurants or other public spaces is an old tactic. We have new tools. I'm wondering if there has been any consideration given to vaccine mandates for public spaces? And second question, restaurants have been impacted by this pandemic dramatically for the past 18 months. Even without mandated closures, lack of consumer confidence, increase in supply chain costs, and a wide variety of other factors have led to 18 months of incredible debt service. Is there any consideration by the county or other organizations within the state of Oregon to provide financial assistance to restaurants and bars?
Unfortunately, we're not in a position to act on all of the financial implementation options that folks can articulate. As I met with your chamber executive directors, thanks to Deanna's organizing yesterday, we were just talking about, well, what if we required vaccinations, proof of vaccination for indoor dining, right? Puts the burden on the unvaccinated. If you don't have a vaccine, you don't get to eat indoors at a restaurant. And what that would involve in terms of providing that card check person or bouncer for all
numbers. Please re-enter your meeting ID, followed by
for all the restaurants here in Washington County alone. And, adding up of those dollars, even with the ARPA dollars, we don't have enough money to cover that expense. So, your first question was, so I'll leave that as my answer to your second question. Maybe the Fed can print that money, but we don't have that in Washington County. Vaccination mandates in public spaces. What I don't want us to do is do something as just one county of 36. This problem is not unique to Washington County. And so, if there's going to be proof of vaccination in any kind of spaces other than in employment buildings, because businesses can do that already. You don't need more permission to do that, nor do we as a county for our own buildings. The state and the federal government needs to put that together. We are just not equipped to do that. And I don't think you want us to take money away from other important parts of our service to you in order to
Welcome to Zoom.
All right.
I'm not trying to dodge the question. I'm really trying to give you a clear answer.
All right, Michelle.
Hi, thank you. So the first thing I'd like to say is a statement rather than a question, and that is, I'd like to encourage everyone to stop focusing on restaurants first. I'm not convinced that restaurants are the first place that we should be looking to stop the spread. I was at an event 2 weeks ago, and it was a large gathering where we thought everyone was vaccinated. It turned out that 2 people weren't, and they slid in under the radar. I have a large 18,000 square foot venue where we keep people safe. They're spread apart. They're masked. I have masked police. I'm doing everything right. Stop making us your number one target. Start looking at other places, please. So that's my statement. Now my question is regarding enforcement. I have come up against OLCC, Washington County. I have talked to everyone. Of course, they have the system. And a lot of it has to do with not having clear, concise,
Chair, again, for being here and allowing us an opportunity to kind of talk this through. If the assumption is that governor will be asking businesses to step in on vaccinations, I put in the chat is it possible that you can get back with you a couple of minutes? Collaborate, as I heard, was an experience for a lot of our employees to try to collaborate and I don't think this is right now. It's a maybe all of our disease and everywhere else, and that makes it a barrier to try to get people who want to be a part of it, their employers and thousands of vaccinate other vaccinations. So if we have more place to go, that would be great.
And our team has worked very hard to try and do that one-stop shop for you. I think that Frankie's on this call and he can help push and really and I try to figure out how the team can make information as clear for you as we're able. Thank you for your understanding. Really appreciate it. The team is, Lower Washington County team is trying hard to help you.
So, Chair Harrington, there's one question that's directly related to the county in terms of a specific question about property tax in the chat. I'm just going to read it and get more up to respond. This is property tax bills will mail out in the next 7 to 8 weeks. In 2020, when we shut down Washington County offers assistance on things such as the simple steps like no interest on unpaid property tax for 2021. Anything is helpful. Interest is 16%. Is there any consideration to provide any assistance on interest delayed on property tax bills?
So, I'm going to use that word that I don't like, complex. Actually, I think that if I remember right, we're being about there being all kinds of awarenesses, limitations on what we can and can't do on property taxes. We'll try and make sure that the FAQs, the frequently asked questions material, is easily available and does its best to outline what the limits of consideration are. So, it's hard. I don't have a good answer for you right now.
I'll just add on to that in terms of another question regarding specifically the restaurant industry that's been probably the hardest hit. Although, we're all getting paid. Any consideration on licensing for restaurants or the number of permits and things that we need to get from the county? Again, I know those are important revenue streams for the county. Just, was there any conversation that might elaborate that?
So the licensing that we do is following the state requirements, and our license fees on that are just cost coverage. It's a very tight budget as it is for covering all of the services that you and our constituents need. So I don't see that particularly changing. I think what our county team is trying to do, and Commissioner Willie and I are both supporting it, is we're trying to make sure that out of the limited ARPA dollars that are available, that we use those for public health and for economic recovery. And that's one reason why we're trying to be very prudent about what we do with those dollars for public health purposes in response to this pandemic. So, for example, as we in our chamber conversation last night, or yesterday, between 4 and 5, we were doing a level of conversation, or implications about what it might mean if the county had to pay for those contract vaccination
I believe, still on our call today. I know we had to jump off a little bit early. But, you know, Matt and the county commission was great about providing, you know, standing up the business recovery centers throughout Washington County. And, you know, there was a provision of PPE that was part of, you know, what we were helping to support businesses. And I know that our PRC and like the others, got to a certain point where like, well, moving out of this, we're done. As I understand it, I know that Matt is working with others to ensure that we still have the supply of PPE for businesses, especially, you know, with these new mask mandates. You know, I'm not sure where the supply is, but my guess is that we're going to be in those situations again. So, is it Lawson that's asking the question? Anybody's your hand, Lawson? Okay. Oh, yeah,
So I asked, I thought about masks, which it's a state mandate, we're following it, it's a state mandate. At the beginning of this conversation, there was discussion about closing indoor dining and how Congress put it back on the counties. And it was talked about very briefly, and we have not discussed that since. Is that something we're discussing as a potential possibility for the county to shut down indoor dining?
I have taken that off the table. It's not me.
Okay, that's what I was
That's not to say that another county commissioner won't bring it forward, but I'm the one who, in response to the information on Monday, Monday Verification Tuesday, drove that proposal in to our meeting on Tuesday.
That's
What's happening today is I've taken that off the table, as informed by our public health team.
yes, they started out with that, which then allowed us the opportunity to pivot, as we're so good at, to other questions that might have been related to the county and where the county's going. So that we did circle back around to say that has been taken off the table for those folks that joined a little bit after that fact. So thank you for that opportunity to clarify.
So Deanna, can I chime in here?
Please do.
So the sign from the OHA, which I did put the link in the chat, when I just went back and looked at it, it says masks, face coverings, and face shields are required. So it would appear that face shields are allowed. Face coverings. The only other mixture that I'm seeing in the chat is questions regarding either mandating vaccines for large outdoor events, or is there any thought of restricting capacity on large outdoor events? I would just summarize what I'm seeing in the chat.
So, you have two county commissioners on this call. What I have said, and I will continue saying, I do not want to see capacity restrictions of any kind in place as just one county.
Thank you.
So, Commissioner Willie tried to unmute himself and turn something earlier, so
Thank you, Chair. Yeah, a couple of responses. One is, I'm looking at the role of the chair here. As well as maintaining our environment and others. So, let's particularly have a cover public dealing with this So I think what I would encourage also is that look at the public health components of our technical place and our progress, but now we're doing it consider tools of progress. And so certify what you can modify to something that's actionable. So I want to be effective. I believe the chamber still has an inventory of K95 masks to free, so if you'd like to get some of those for your home and your businesses, please do that. But that's we have got to make sure that when we do wear a mask, that we are using the most effective mask that we possibly can to stop the spread. Remember, this spread is 8 times more spreads faster than any of the previous COVID. So we have to be more diligent about the type of mask we use as well.
Thank you, Commissioner Willie. Michael, I see you have had your hand up recently. Still on, okay. Okay.
And that is, my wife was an emergency room nurse for years. And I don't understand where you come into a dine-in area and take your mask off and how that is supposed to do anything. And what is the science here?
Let us be clear. We're not saying it is safe for vaccinated people to dine without wearing a mask. We're not saying that. No public health person is saying that, and I'm not saying that. So the Delta variant is the dominant variant now in our state. The prior variant that was dominant had what they call an R0, which means that a person who
stuff like wear a mask and then take your mask off and eat, and then none of this makes scientific sense to a guy that is employs nearly 100 people with full benefits, retirement. I've been doing it since I was 18, and now I'm confused. Now, I am fairly smart, believe it or not, but I'm confused how this is going to help.
I don't doubt your intelligence and everyone else's intelligence. The CDC has continued to learn more. This Delta variant has changed everything. It doesn't matter if we get COVID or not. There are lots of stories that you can see on the national media where people have been sickened by COVID previously. They've been sickened by this Delta variant. And the science is there to say that even vaccinated people can get the Delta variant, and vaccinated people can transmit it. So I know I cannot represent the science adequately. All I can tell you is what public health has recommended to us as we serve as the public health board for the county.
Thank you, Chair Harrington. I think we just have a few minutes left, and I want to make sure that if there are any final questions, we can make sure to get those in. We do have one in the chat from Donna Gestes. She is a Hillsboro City Councilor and a restaurant owner, and she says, I agree, restaurants are very punished and affected by following the mask mandate pandemic itself, especially in small businesses. Has there been a recorded action study based on the infection, where the infections are happening, are they family gatherings, churches? Do we really know where these are happening?
So this is where I made the recommendation on Tuesday based upon the best science and what the data shows. As the public health economist outlined for us in the presentation Monday, and I asked for further clarification, every surge until this latest Delta variant surge occurred before we had vaccinations. The facts show that the majority of people showing up in the hospital right now with COVID are previously unvaccinated people. Some of them are vaccinated people, right? The latest OHS graphic shows that 97% of the people are unvaccinated. The prior surges show that the common thread of actions that have been taken was reducing dining to alcohol only and takeout. But looking through all of what that entails, what it impacts, we cannot guarantee that that will protect people's health while preserving our fragile economic recovery. So, since I sit here this morning with new information that says there will not be a state shutdown, I am pained by the fact that people may still get sick, but they may not. Right? So all I can tell you is I am not promoting an action that will restrict dining. And that's based upon the best informed science and public health that is available to me in my capacity as a member of the Board of Commission that serves as the Public Health Board for Washington County.
So thank you very much. We are about 4 minutes away from the 11 o'clock governor's press conference. We want to make sure everybody has an opportunity to change channels, if you will. I would also just remind you to save the chat. If you want to listen there, that will provide a lot of information. So save the chat. And I want to thank you so much. Thank